Good day. My name is Raquel Hatulan, a first-year student nurse at Davao Doctors College. I am from Section 11C and my RD group is Group 11. In this video, I will show you the assessment of the abdomen. Before meeting the patient, I have to review the patient's medical record and also the doctor's order sheet to verify the order. The scope of my assessment is the abdomen. For this, the equipment that I would need are my marker, tape measure, a small pillow, and my stethoscope. For doing the procedure, I have to perform hand washing to deter the spread of microorganisms. Good morning, ma'am. My name is Raquel Hatulan, a first-year student nurse. I will be assessing your abdomen today. Before we proceed to anything else, I would just like to confirm your identity to be sure that I have the right patient today. Can you please tell me your name, age, and birth date?
Patient Bungkayaw, 49 years old, December 30, 1970.
Okay, so during the assessment, how would you like me to call you or address you?
Raquel.
Okay, Rachel. So the focus of our assessment today will be the abdomen. So I'm going to have you lay on the bed, and also I'm going to assess this part of your body. So I'm gonna have to palpate it, percuss, and also auscultate. It is very important that you do what I will ask you to do later so that our assessment will be successful. Okay? Do you have any clarifications, questions?
No.
Okay. I want you to know that the medical procedure that will happen here will remain confidential to protect your privacy. Also, I am going to close the door and also the curtains to assure the comfort of my patient and also to keep our assessment from distractions. Okay, Rachel, this is your patient gown for the assessment later. This will be the bed for your assessment. Okay, please sit down. So, I'm gonna ask you if you have already urinated.
Yes, ma'am.
Okay, so it is important for our patients to empty their bladder before the abdominal assessment because this will give more accurate result, and this will also help them to feel comfortable. Now we are at the working phase. The first thing that we will do is survey the abdomen. Rachel, please lie down. Okay. Now we proceed to observing the abdominal skin. I'm also going to inspect the umbilicus for its contour, color, and location. Now I'm going to inspect the abdominal contour. Along with this, I'm also going to inspect the abdominal girth. Now, I'm going to measure the abdominal girth with a tape measure. Ma'am, stand up lang po tayo. Okay. Yep. Okay. Ma'am, please don't remove the mark because that will serve as the marking site in your umbilicus area. The next thing that we will do is check for the abdominal symmetry. Okay, so ma'am, please raise your head. Okay, and then inhale and exhale. Now I am going to auscultate the abdomen. First, we're going to auscultate for the bowel sounds. I am going to use the diaphragm of the stethoscope because intestinal sounds are best accentuated by the diaphragm. Also, I have to make sure that the stethoscope is warm because cold stethoscope may contract the abdominal muscle. The next thing that I would do is auscultate for the vascular sounds. What I will use here is the bell of the stethoscope. The next thing that I will auscultate is the venous hum. We're still going to use the bell of the stethoscope. Now I'm going to auscultate for the friction rub over the liver and the spleen. I'm going to use the diaphragm of the stethoscope now. Now we move on to the percussion of the abdomen. The first thing that we will do is percuss for the tone. Now I'm going to percuss the span or height of the liver by determining its lower and upper border. Now I'm going to assess the descent of the liver. Okay, Rachel, please hold your breath while I percuss. Okay, after I do that, that's the time when you exhale. Okay, 1, 2, 3, inhale. Okay, exhale please. Thank you. So now I'm going to percuss the upper border of the liver. So the liver span is 4 centimeters. I'm going to do the same procedure, but this time I'm going to do it on the mid-sternal line. So, please inhale, exhale. 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 Breathe out. Okay. It's 3.5 centimeters. Now I'm going to percuss the spleen at the mid-axillary line. The next thing is that I'm going to perform another method. I'm going to percuss the spleen on the anterior axillary line. 1, 2, 3. Okay, breathe out. So now I'm going to blunt percuss the liver. Okay, Rachel, if there is any tenderness, tell me, okay? Okay. There is no any tenderness. After the liver, I'm going to perform a blunt percussion on the kidneys. Okay, so Rachel, tell me if it hurts, okay? Now I'm going to perform the test for ascites. Okay, Rachel, can you please face on that side? Okay. Please straight. Okay. 1, 2, 3. And the next test that we are going to perform is the fluid wave test. Place your hand here. This one. Okay. Place it like this. We're now going to palpate the abdomen. Okay, Rachel, please lay down once again. Okay. First, we're going to perform a light palpation. Tell me if there is tenderness. So our patient did not react for any tenderness. Now we're going to palpate it once again, but this time we're going to do the deep palpation. Tell me if it hurts. Does it hurt? During the light and the palpation, we also palpated for masses. So we did not locate any masses during that palpation. Now we proceed to the palpation of the aorta. Now we are going to palpate the liver. Okay, Rachel, I'm gonna put my hand here. And then, inhale. Exhale. Exhale. Tell me if there is any tenderness. Now we're going to palpate by hooking. Rachel, please take a deep breath. Does it hurt? Now we're going to test for the cholecystitis. Okay, Rachel, I'm gonna ask you to inhale again. 1, 2, 3. Inhale. Is there any pain? Okay. Now we're going to palpate the spleen of our patient. Okay, Rachel. Once I start palpating, inhale for me. Okay, 1, 2, 3. Inhale. Is there any pain? Now we are going to palpate for the kidney. The first kidney that we will palpate is the left kidney. Okay, Rachel, we're gonna have to inhale for me again. 1, 2, 3. Okay, exhale. Okay, we're gonna move on to this side. Okay, Rachel, 1, 2, 3, inhale. Exhale. Exhale. Breathe out. Inhale. Breathe out. Okay. Now we are going to palpate for the urinary bladder. Hey, Rachel, tell me if it hurts, ha? So the procedure that we are going to perform now is the hypersensitivity test. So for this, I'm going to use cotton buds. It will help me to do the test. Okay, so we're gonna observe how she reacts. Now we're going to assess for the psoas sign. Okay, Rachel, please face on the left, lie on this side. Okay. So I'm going to use your right leg for this one. Okay, so I'm going to observe your reaction. Okay, 1, 2, 3. Tell me if there is an abdominal pain. Does it hurt? Okay. The next test is to assess the obturator sign. Okay, Rachel, please lie on your back once again. I'm still going to use your leg. So, we're going to use your right leg. Okay, tell me if it hurts. I mean, if something on your abdomen hurts, okay? Okay. Then, internally, externally. So nothing hurts? Okay. So the last test for the assessment of the abdomen is the test for appendicitis. Okay? Rachel, I'm gonna start palpating it, and if there is tenderness or if you feel any pain, please tell me, okay? 2, 3. Does it hurt? No. Okay. Hurt? Does it hurt? No. Hurt? No? Okay. Okay, Rachel, so our assessment has ended. Okay. Okay, so let's change your throat. Okay, Rachel, so during the inspection, I did not find any abnormalities. Your bowel sounds are normal. Also, during the percussion and palpation, I also did not find any abnormalities. When I was doing that, you did not tell me that you felt any tenderness, so that's great. Ascites is not present, you don't have appendicitis, and you don't have an inflammation of the gallbladder. Okay, so everything was normal. Okay, so our assessment ends here. Thank you so much. Thank you for being so participative today. Now I'm just documenting the findings. We do this to help to keep track of the patient's medical records.